Hello, from the Illinois Psychological Association 2020 Annual Convention. I'm Dr. Daniel Brewer, and I'm the current president of the IPA. I'm excited to be with you today to present a very special award. It is my pleasure to present the Illinois Psychological Association State Elected Official Award to Governor J. Robert Pritzker. In 2018, Governor Pritzker stated, "It's time to make mental health and spending a priority." You'd think mental health would be a priority in our state, one that would be talked about openly and honestly at home, and in our schools and in the workplace. For far too long, politicians from both parties have been too timid when it comes to shining a spotlight on and addressing mental health. 2020 was one of the first times in recent years that Illinois lawmakers presented a budget that Governor Pritzker later signed that increased funding 19% for addiction treatment and 13% for mental health services. Governor Pritzker continues to support increased mental health funding in his 2021 budget. He plans to use some of the cannabis tax money for funding addiction and mental health services. This is the second year in a row that Governor Pritzker has proposed putting more money into mental health and addiction treatment services. Governor Pritzker is also working to hold insurance companies accountable. On July 15, 2020, he announced that 5 Illinois health insurance carriers had been fined more than $2 million for violating parity laws. On March 15th of this year, Governor Pritzker issued an executive order requiring that telehealth services be included in the provision of healthcare, psychiatry, mental health treatment, substance use disorder treatment, and related services to patients, regardless of their location, through electronic and telephonic methods. He further ordered that all health insurance carriers regulated by the Department of Insurance are required to cover the cost of all telehealth services rendered by in-network providers to deliver any clinically appropriate, medically necessary, covered service and treatment. While these executive orders are limited to 30 days, the governor has continued to reissue these orders throughout the pandemic. Governor Pritzker is also working to reduce stigma of mental health issues and substance use disorders. He has openly shared how, when he was 7 years old, he lost his father to a sudden heart attack, which understandably severely affected his mother. She struggled to overcome depression and alcoholism while caring for her 3 children. Tragically, she died in a car accident when JB was only 17 years old. It is clear that mental health treatment is personally important to the governor, and he has been a strong advocate for mental health within Illinois. We are truly pleased and honored to present this award to Governor J.B. Pritzker. I want to thank Governor Pritzker for sending along this message, especially given the current health crisis facing our state and the nation. We are appreciative he took the time to personally acknowledge this award. I also want to express gratitude to Dr. Terry Kohler and Ryan Taylor and the IPA lobbyist Taylor Huey for their continual work. Thank you.
I want to express my sincere gratitude to the Illinois Psychological Association for presenting me with the 2020 State Elected Official Award. Behavioral health has always been a priority for me, perhaps because I've seen firsthand the difference mental health professionals can make in people's lives, and how mental health care has been neglected by our elected officials over many years. Mental health is equally important as physical health. Let's stop pretending otherwise. I'm proud to have increased funding in the state's budget for mental health and substance abuse treatment, and there's much more to do. I've prioritized fighting stigma, and I continue to encourage treatment and coverage for those who suffer with a mental, emotional, or substance abuse disorder. The COVID-19 pandemic has been challenging for us all, but has really underscored the value of mental health services. That's why back in March, I required all health insurers to cover telehealth services, including behavioral health, and required them to reimburse providers at the same rate as in-person visits. My administration also created a remote patient monitoring program and mental health support line to reduce barriers to health and mental health services, focusing especially on our underserved communities. This program significantly expands telehealth for addiction and mental health treatment for over 3 million Medicaid members. I'm proud to receive this award, and I'm very grateful for it. And to all our clinical psychologists who serve the people of Illinois, thank you for the critically important work that you do. Please know how important you are to this state.